on the evaluation of diagnostic utility of serum ACE, MAN2 and lymphocyte in ocular sarcoidosis and tuberculosis. Ocular TB and sarcoidosis are two diseases with overlapping clinical features, and differentiating one from the other is a challenging task. They are even postulated as opposing presentation of the same disease spectrum. Sensitivity and specificity of ACE, MAN2 and lymphocyte vary in different study populations. Studies depicting their utility in combination are scarce and are quite relevant in TB endemic countries like India. The purpose of the study was to evaluate diagnostic utility of ACE, MAN2 and lymphocyte both in isolation as well as combined in the diagnosis of ocular TB and sarcoidosis. The outcomes were sensitivity, specificity, positive and negative predictive values. This was a prospective observational study done for 2 years in Aravind Hospital, Pondicherry in 95 patients with uveitis of age more than 18 years. We excluded patients with history of trauma, immunosuppression, AC inhibitor use and steroid use. The diagnostic criteria used were the revised IWS criteria for sarcoidosis and Gupta et al. Criteria for TB. Serum ACE was estimated using a substrate FAPPG. We analyzed 118 eyes of 95 patients. Ocular TB was seen in 12% of the study population and sarcoidosis was seen in 20% of the study population. ACE was elevated in 89% of sarcoidosis and only in 33% of ocular TB. The mean value was 76.2, which was statistically significant compared to TB. MAN2 was positive in 58% of TB patients and only in 15% of sarcoid patients. The mean value was 12.67, which was also statistically significant. Lymphopenia was seen only in the sarcoid group in 10% and it was not seen in the other groups. The elevated ACE had a very good sensitivity and negative predictive value in detecting ocular sarcoidosis. Negative MAN2 also had a very good sensitivity and negative predictive value. Since lymphopenia was seen only in the sarcoid group, the specificity and positive predictive value was as high as 100%. Also, when the three parameters were combined, the specificity and PPV became 100. In ocular TB, both elevated and non-elevated ACE had a good negative predictive value. Also, the positive MAN2 had a very good negative predictive value of 93.4. The area under AIOC curve in sarcoidosis was maximum for elevated ACE. When compared to lymphopenia and negative MAN2, this was statistically significant. In ocular TB, the AUROC for positive MAN2 was 0.83. This was also significant. To the best of our knowledge, no study conducted so far has tested the combined utility of elevated ACE, negative MAN2 and lymphopenia in ocular sarcoidosis diagnosis. Also, we analyzed the utility of serum ACE in ocular TB. This was an observational study where randomization was not done. Also, the study happened during peak phases of COVID, so viremia could have affected the lymphocyte value. We didn't have any biopsy proven cases. Subjects were either presumed or probable sarcoidosis or probable and possible TB. Elenga et al. Study from South India says ACE was an independent risk factor rather than ACE and lymphopenia in combination, whereas Scott et al. Says the combination improved the diagnostic performance. According to our study, when combination of elevated ACE, negative MAN2 and lymphopenia used, there was a better ability to diagnose sarcoid rather than this test in isolation. As NPV is very high, in subjects with normal ACE, further screening test for sarcoid is needed only in case of strong clinical suspicion. Even though ACE was elevated in some patients with TB, it may not serve as a diagnostic tool in detection of TB. As NPV is very high, in case of negative MAN2, further screening test for TB may be necessary only if there is a strong clinical suspicion. Since serum ACE level is also a better test compared to negative MAN2 and lymphopenia in discriminating ocular sarcoidosis from other diagnoses. Also, MAN2 is a better test for discriminating TB from other diagnoses. These are my references. Thank you.
Lots of sophisticated tests in TB. Why you are using MAN2?
Sorry, sir.
Lots of sophisticated tests to diagnose TB and sarcoidosis. Why you are in choosing MAN2 test?
Sir, I didn't get it.
Better test for diagnosis of tuberculosis. You're using MAN2, but there are other tests also, more sophisticated.
Yes, sir, it's the gold standard test is basically biopsy or demonstrating the mycobacterium tubercle in fluid, but it's a very invasive test. And so also ocular TB when compared to extrapulmonary TB is paucibacillary. So even if we take so much effort and do an invasive technique and demonstrate and try to demonstrate, because of its paucibacillary nature, the test may be negative. So this is very easily viable, and in a country like India, this is more economically also viable for the patient. So when there were similar published literature when they combined different parameters. Yes. These parameters were chosen based on the diagnostic criteria, sir. Madam, basically ocular TB and sarcoidosis are two mimicker. No, but there was no published literature saying the specificity is quite good and positive predictive value.
Okay. Thank you.